Good morning, my name is Ekaterina Yatskovich and today I will tell you all the most important things about the health formula. This disease is often called a mute stomach ulcer and 12 duodenal. The intestine may not manifest itself in any way and then suddenly become aggravated, and today the health formula will figure it out on this issue. Favorable conditions for the development of ulcers. Increased acidic stomach can provoke the disease, and constant lack of sleep and frequent climate change and poor nutrition and stress, as well as taking non-steroidal anti-inflammatory drugs, but most often the disease is associated with the Helicobacter pylori bacterium. Symptoms are not ulcers. There may be acute pain in the stomach or in the area. It's gnawing in the stomach, and constant or burning. It can give back more, subsides after eating, and after 20 to 30 minutes reappears with an ulcer. The duodenum can be night pains, and they are also called hungry, not rare nausea, vomiting, heartburn and constipation. The main diagnostic test and the scaffold of Danscopia during the course of a year can additionally take a biopsy on Helicobacter and atypical cells as well. Determine pH acidity. Friends, do not rely on a stomach ulcer diet to be treated better comprehensively and under the supervision of a gastroenterologist, but here are the basic rules. It's useful to know everyone. Our experts' number one remedy is a medicine that removes excess acid. This is the so-called proton inhibitor. Pump-omeprazole, Ponta Libd Rabbi Pro for Ulan Pro Evil and so on, which very strongly suppress the release of hydrochloric acid from the cell, and thereby they quickly remove the symptoms of the disease the second moment we talk about the important role of Helicobacter. Therefore, if I am evil, if we confirmed Helicobacter, yes, especially in the first place, of course, it's better about the little thing, but for the sake of treatment. Katia, that is, the eradication of Helicobacter, is a separate conversation. That is, here we will talk about antibiotics, and the schemes are tough. The doctor, at his discretion, cannot combine any antibiotics that are prescribed, and not many groups of drugs that work, and here they are. Used together with these proton pump inhibitors, and sometimes bismuth preparations are added up to an average of 2 weeks. Helicobacter can be treated, as it were, that there would be no relapse and some complications. Try to visit your general practitioner or gastroenterologist regularly, even if there are no symptoms of exacerbation. Once a year, a routine examination will not hurt, and yet one question remains: what to do with Helicobacter, which is sometimes found even in the absence of an ulcer or gastritis. About it in our next issues. I hope everything that we told you will be useful for your health formula. All materials in this section are available on the Winter website. Hit on our YouTube channel. Come see, sign up to the meeting.